To item number 2, the consent agenda. All the following items which concern reports and items of routine nature normally approved at day-to-day meetings will be approved by one vote, unless any trustee desires to have a separate vote on any or all of the items. Consent agenda consists of discussion, consideration, and action on the following items. A, the minutes of the regular trustee meeting, June 30th, 2026. B, finance committee meeting, July 23rd, 2026. Check report, June 9th, 2026 to July 8th, 2026. Do I have a motion?
So moved.
Thank you. I have a motion.
Second.
A motion by Dr. Brown. Didn't get all my people down here. Hold on. And a second by Dr. Simon. Any other questions? Roll call.
Bowman,
Yes.
Burke,
Yes.
Simon,
Yes.
Mossberg,
Yes.
Brown,
Yes.
Hannaford.
Yes. Okay. We are going on to agenda item 3, CEO's report.
All right. In my board report, Regina Wilson, as you can see, reported that we continue our collaboration with Northwestern's nursing program for their fall clinical rotations. We also hosted a family nurse practitioner student that was with Ryan San in the emergency room. And then we also continue being a training site for the paramedic students for their clinical rotations. We always enjoy that, getting that exposure. Clinics have been busy. Visits were up over 300. I continue to be very proud of the reviews we send out for patients when they are scheduled to see a practitioner. They get a text, and we've got a good percentage of those coming back, and the providers are doing a great job. Most of the time, they're getting 5-star reviews, which is wonderful. We're preparing for Dr. Newton's arrival. He starts at the end of August, and we have hired a couple of MAs for that clinic. We talked about in MedStaff this last month, we're going to change up the weight loss program. Those drugs will be shipped directly to the patients. We will still do the training and education regarding those drugs, but the patients will order those drugs directly from the compounding pharmacy, and those will be delivered to their home. Otherwise, BCA is a module that we have finally wrapped our arms around, and we are tickled about it. That is a module within Meditech Expanse that we can mine data, any data that's in Meditech we can get our hands on now, where we couldn't before. So very, I won't say easy to run reports, but it is very helpful to be able to get the data out that you need to look at. So I'm still learning to use that, but it's been very helpful. You can see our activity related to our firewall protection and everything from Reese. That's still looking good. Hired a few people. We've had 5 new hires. And one last thing that I want to leave you with, I think I mentioned maybe last month that we were having issues with our billing company. Shocker, I know. That company, I'm just going to own it. I mean, it does come down to me. But we were with CodeQuick, and it was going so well before December, and we found out that they sold that company, and then the new, I guess, management started in January. And from January until now, you can see a decline in the performance, and we've looked over that in Finance Committee at length, and so we drafted a letter and sent to CodeQuick. It's now called Sustainable Billing Solutions. Is that right? Sustainable.
Barely sustainable.
But yeah, Sustainable Medical Solutions. And we sent them a letter to notify them of contract breach, and listed those things that they are in breach of contract. So they have 30 days to cure. If they do not cure the breach, those items within 30 days, we do have the option of leaving that contract. So we're watching that. That will come August the 7th, and we'll take a look at it and see what's going on and make a decision if we are willing to stay. And I just told him what I learned with TrueBridge is that if you're not doing your job that we're paying you to do, we don't have to stay. So we'll find another company if that's what it takes. It was going good, and I think that it can be. We can get back there, but we're not gonna give as much grace. We don't have to. So if we have to switch, we'll switch. Does anybody have any questions for me?
Do we have potential options?
Oh, there's always options.
I know, but have we done any
Yes.
investigating? So are there good ones?
Yes.
Hopefully.
I think that if this doesn't work, that there are options that we should entertain.
That's a good option. Good.
So.
Anything else? Any other questions, Candace? Hearing none, do I have a motion for approval to accept the Share Medical Center report?
Can I
Yep.
take that back?
Yep,
I didn't realize
hold on.
that's what that was enough for. So, I don't know, maybe this is asking for forgiveness instead of permission. Where's it at? Oh, there it is. Behind my report, so this is a logo. We kind of did this.
That's the next one, that's B.
Oh, that's B?
Yeah.
Thanks, Shane.
Okay, so we will
Would you
go
like to go
back
to
to,
that?
we have a motion
I
to,
move to accept the Share Medical Center written report for June 2026.
thank you, Dr. Simon. Do I have a second?
I'll second.
Thank you, Mr. Bowman. I have a motion by Dr. Simon, a second by Mr. Bowman to approve and accept the Share Medical Center written report for June 2026. All in favor, or excuse me, roll call?
Bowman,
Yes.
Burke,
Yes.
Simon.
Yes.
Mossberg. Yes. Brown,
Yes.
Hannaford.
Yes. Get a few more meetings confused sometimes where we can do things. Now we will go to item 3B, approval to accept the updated Share Medical Center logo, which,
So this kind of came out of, they wanted sweatshirts. They wanted to be able to wear sweatshirts in the winter, and they wanted new t-shirts. And so we started playing with it. Maddie Perks, our HR director, actually designed this logo, and we got sweatshirts last winter, and it went over so well that we actually opened a swag shop for our staff. They can go on and order, and it's really cool because it helps support our Morale Booster Club to do things. So anyway, it's kind of turned into us using this logo over the one that's on the building that we've used for years. And the reason we did that is that logo right here, this logo, it's really hard to put on a shirt. Like it does okay on a shirt here, but when you put it here, it's off balance. It looks goofy. So I guess I'm asking for permission to us to move to this logo eventually. I'm not asking to change the signage, anytime soon or anything, but I think I'm asking that anything that we start printing and going forward, that we would eventually transition to this logo. What do
And
you
it's the
guys?
same price as just using the other, we're just changing logos.
Yeah, we're just switching. Oh, you want to go home?
No. Just kind of ho-hum on the,
What?
it's nice, but it's plain. It's nice. I like it better than the other one.
You think it's boring?
It's just-
Yeah, it goes on a
it's
shirt
kind of
good.
plain.
It looks good on
Our
a
shirt is
shirt.
on her shirt.
It looks well. It
Oh,
looks
see?
good on a shirt.
Oh, you don't even have the right one on though. So we forgot the
That's
St.
close.
Anthony on the first version. See, it looks better than the one she has on.
Oh,
We forgot the
that's
St.
huge
Anthony
difference.
tagline. But help.
making progress all the time.
We are.
That's right.
I did like better than the old one.
Thanks, Scott.
Any questions or, can I do a
I'm
motion for
Yeah,
item
you
3B?
I move that we approve the updated Share Medical Center logo.
Thank you. I appreciate that.
Thank you. Do I have a second?
Second.
Thank you. A motion by Dr. Brown, a second by Dr. Mossberg to approve and accept the updated Share Medical Center logo. Roll call?
Burt,
Yes.
Simon,
Yes.
Mossberg,
Yes.
Brown,
Yes.
Hannaford,
Yes.
Bowman.
Yes.
Okay, moving on to item 4, CFO's report. First, A, statistics report and financial report.
I wish I had something better to report in June, but we're still in our summer months. Revenue is down. AR is up. June also has some extra factors working against it that most of the other months don't. Since June is the end of the fiscal year, that is when we get into our audit accruals, and all that kind of gets compiled into June. June also had a Medicare clawback.
Why don't you explain that a little bit, like on the accrual? I don't know that they.
So at the end of the year, we look at payroll. We have to make an accrual if our numbers are slightly off. In different, we balance receivable accounts. We match with the banks every month, but different things can pop up. We haven't actually found a lot this year that has caused more issues. We just try and take care of all those things before they get to the audit, so that audit becomes cheaper, less time consuming, and the auditors and everyone else can have more, what's the word I'm looking for? They can have more faith in our work that we're doing. Yes. June also saw a big inpatient drop. So we only had $185,000 of inpatient revenue for June. Like I said, the Medicare clawback was about $338,000 in the month of June. That total gets added to the Medicare contractual, because that's essentially what it is. We also had with our AR rising,
Which is the problem with sustainable, is that
Yes.
our accounts receivable isn't getting worked.
Mhm.
And the threat with that is it becomes less and less collectible the older it gets.
And so you'll see on the bad debt expense, closer under the operating expenses, you'll see June had a $219,000 bad debt expense. That is due to that AR getting larger, like she said, getting over 150 days, and then we almost see it as being uncollectible at that point. So those are a bunch of the factors working against June. We ended the month with a cash balance of $241,000. We also, our AR was up to over $5 million for the first time in a very long time. Accounts payable was up, but July is showing July is showing to be down quite a bit. We will also receive SHOP in July, so we're having a very rough June. We will have a very pretty July. Hospital contractual, less bad debt, and charity care were 57.4% of gross patient revenue. Net patient revenue for the month was $1,017,477. We did not write off anything to collections in the month of June. We will have a larger write-off in July. Charity care for the month totaled $150. Operating expenses, excluding salaries, benefits, and depreciation, bad debt, and charity care for June totaled $927,000. Hospital salaries and wages were down about $80,000. Hospital net operating loss for the month was $634,000, and the hospital net loss was $516,000. As you can see in the budget comparisons, we're doing well over what we were doing in the previous year. Getting out of implementation helped significantly. Aged payables, as of 5/31, 41% of aged payables were considered current. As of 6/30/26, Medicare had clawed back $338,000. June was down in patient days, but up in clinic days, or clinic visits, as Candace said. We did not have a revenue cycle report for June. We are currently working with the company to resolve multiple issues on that. Still waiting for the chronic disease management grant to come back.
We didn't get it.
Oh, we did not get it. I hate to report that. We have 3 other grants currently in the works. We have a P3 grant, which is connected to our capital project. We have a micro grant, which we had received, and I reported on that last month, which started to purchase
So we hired Amanda Lambert for the CHW community health worker. One of the things that she's working on, like community resources, hooking our patients up that need community resources, whether it's food insecurity, living, whatever. One of the things that she's also helping us with is getting our patients signed up if they need Medicaid, help with assistance there. So, and that's helpful for us as well, because a lot of times they won't fill out the paperwork. So she can help them walk through that process. Is that what you're
Yes, that's exactly it.
Has Medicare taken back all that they need, or is that just gonna keep going?
They were supposed to take back $379,000. We are unsure why they stopped clawing back. We've been trying to get a hold of them. They hate to give information, so we're just trying to figure out if they're going to claw back the rest of that, or if they have been looking at our claims and maybe decided that they felt we were made whole again.
That was my question, so we don't know even if they're going to, when it's gonna be.
We're not sure as of yet if they're going to take the rest of that amount.
Sounds so nasty.
Yeah.
Clawback.
Clawback.
Claw back. It's as bad as it sounds.
It's as bad as it sounds.
It is as bad as it sounds.
It's not right.
Well, as many as you remember that, June's always typically a slower month, especially for the inpatient in the hospital, and a clawback of nearly $340,000 makes a difference.
I got a question. Billing company, how bad is the billing company affected those numbers now?
Like I said, the $219,000 bad debt expense is primarily due to letting accounts age and not being worked. When our AR is $5 million, and you can see our AR 6 months ago.
So I'm looking, I've got a running total, and in July of '25, our accounts receivable was $3.5 million. Today, it's $5,019,000. That hurts. We have not been, our highest during the last 12 months.
Is a lot of that going to go to collections then, if they're that old?
The highest our collections had been prior to January was 3.3.
That was when?
October.
October of last year.
So you're saying from January to July, $2 more million has been added to?
Yeah.
And that's
Yeah.
why we're looking
There was a
for
question, I'm sorry, I was thinking, what was the question? What did you ask? What did you ask?
He asked if it was going to be sent to collections.
Yeah, all of that
It has to
money,
hit
how
the
much of
insurance
that is
fund.
going to
That's
be?
the problem is it has to go to the insurance company first. And that's the problem is they're not getting claims out. It's got to go to the collection company, or it's got to go to the insurance company first. They've got to work it, and then the patient gets 4 statements
And 2 phone calls.
and 2 phone calls before we can turn it to collections.
Okay.
So there you are. I mean, you're 5 months at best.
So how old are some of these? Because the new company was supposed to fix all of this.
They did do a really good job for a while.
Until they got
and then
bought out
sold,
by the new company.
and they started dropping the ball.
So every 3 months they add another million, because it was 6 months ago.
Yeah.
And we just have to do 30 days to figure
And
out.
in your packet, you can see, we identified this.
That's great. I was thinking, if we have to go 3 more months or something.
No, you can't afford to.
No.
From just January to February, they jumped $1 million. And then they had another large jump from March to April. They're currently actively working on that. Do you guys have any other questions for financials?
Do you want to talk to me about positive with the 340B?
Yeah, 340B, you can see in your packet, is rising every month. We've been working closely with holders, and we're now working with Walmart to capture those claims, since the government is now allowing us to have 2 contract entities versus just the one. So So you can see we had one of our best months in June, 28,000 net income, and we are excited to see that rise. I think July will be a great month from the preliminary numbers I've seen. As of 6:30, our line of credit is at $190,000, and we look to pay a significant portion of that off at the end of July.
Okay. Any questions for Jaden? Hearing none, we will move to agenda item 4B, renewal of the High Plains Bank line of credit, which we just talked about. So this will just be renewing it. Is it still just a 1 year?
Yes.
Yep. Any questions about that? Hearing nothing, do I have a motion?
I move we approve the renewal of the High Place Bank line of credit.
Thank you, Dr. Brown. Do I have a second?
Second.
Thank you, Dr. Simon. I have a motion by Dr. Brown, a second by Dr. Simon to approve the renewal of the High Plains Bank line of credit. Any other questions, further discussion? Roll call?
Simon?
Yes.
Mossberg?
Yes.
Brown?
Yes.
Hannaford?
Yes.
Bowman?
Yes.
Burke?
Yes.
Okay, item 4C, discussion action to approve or disapprove the contract amendment number 1 for the building improvement project to include the updated pricing from the RFP process as well as overtime labor for AHU number 2 installing AH1 number 1 in the new location shop area, which we'll discuss all this. Projected downtime will be 1 to 2 weeks for the surgery areas with these options. One, and I'll quickly try to explain, but in our finance meeting, if we stay with our same location, it's going to take our downtime back to that 1 to 2. If we move locations, it was going to be 6 to 8 weeks, which obviously, if you look at the downtime of what it would cost us not running our operation, finance committee and Dr. Mossberg can jump in anytime, but felt like this was a good move for us to go ahead and get it done as quickly as possible and leave it in the same area, which they said it's still going to give us plenty of
I
room.
think it would, what was it, 25,000 in overtime?
Yeah, oh, yeah.
Yeah, $24,010 to keep that in that new location, and that is also to do air handler 1 and 2 at the same time so that we can keep that downtime
Yeah,
as low as
saves us
possible.
even on the other one. So it sounds like a lot for overtime, but when you compare it to what we could lose being closed down for that long, we feel like it's our best option. Anything else you guys want to add on that? Any other questions? You got anything? All right, do I have a motion for item 4C?
I move that we approve contract amendment number 1 for the building improvement project.
Do I have a second?
Second that.
A motion by Dr. Mossberg, second by Mr. Bowman, to approve the contract amendment number 1 for the building improvement project to include the updated pricing from the RFP process as well as overtime labor for AH number 2. Installing AHU number 1 in the new location, the shop area, with projected downtime will be 1 to 2 weeks for the surgery areas with these options. Roll call?
Mossberg?
Yes.
Brown?
Yes.
Hannaford?
Yes.
Bowman?
Yes.
Burke?
Yes.
Simon?
Yes.
Okay, item 4D, discussion and action to approve or disapprove the contract amendment number 2 for the building improvement project to install a water softener system for the mechanical HVAC equipment, the cooling tower, chiller, and boiler. Anything?
For obvious reasons.
Yeah, I mean, you guys, we've all lived in Alva long enough to know that how this can help our operations down the road, so. And that's,
Early deterioration of the equipment.
yes, our hard water.
Our softener they had a mishap and it ended up costing us $8,000 to have the entire boiler acid washed.
Descale.
Because we lost soft water for maybe a day or two.
I don't know.
It wasn't long.
questions, discussion? Do I have a motion?
I make a motion, we approve contract amendment number 2.
Second.
Thank you. A motion by Dr. Brown, second by Dr. Simon, to approve the contract amendment number 2 for the building improvement project to install a water softener system for the mechanical HVAC equipment. Roll call?
Brown,
Yes.
Hannaford,
Yes.
Bowman,
Yes.
Burke,
Yes.
Simon. Yes. Mossberg.
Yes.
Okay, agenda item 5, medical staff executive committee, Dr. Burke.
So the credentialing committee needs to bring to the board 2 reappointments to courtesy staff, and that's all I'll have today.
Okay. Make it first. First one is B1, the report appointment to courtesy staff, Toby Abram, DO.
Yes.
I have a motion by Dr. Burke. Do I have a second?
Second.
Thank you. A motion by Dr. Burke, second by Dr. Simon, to reappoint to courtesy staff, Toby Abraham, DO. Roll call?
Hannaford,
Yes.
Bowman,
Yes.
Burke,
Yes.
Simon.
Yes.
Mossberg.
Yes.
Brown.
Yes.
Okay. Then we have B2, the reappointment to courtesy staff for Keisha Min, MD. Motion by Dr. Burke. Do I have a second?
Second.
Thank you. A motion by Dr. Burke, a second by Dr. Simon for reappointment to courtesy staff for Keisha Min, MD. Roll call.
Simon.
Yes.
Mossberg.
Yes.
Brown,
Yes.
Hannaford,
Yes.
Bowman,
Yes.
Burke.
Yes.
Okay. Agenda item 6, coffee report. Candace, anything you want to bring to our attention?
No, it looks pretty boring, actually. There wasn't a lot that went on.
Okay.
Unless you see something you want to know more about?
Any questions for anybody on the coffee? Okay, hearing none, we will move to agenda item 7, patient care. First thing we have in 7A is our contract review and quality evaluation, which if you look at, everything was
100%.
100% besides the,
I don't think we're using them.
okay, that's right. All right, any questions on the quality evaluation? Hearing none, the following items from 7B to 7C are all routine policies and procedures. They will be approved or disapproved by one vote unless any member desires to have a separate vote on any or all of the following items. B is the discussion and action to approve or disapprove the revisions report dated June 30th, 2026. And then C is the approval or disapproval of the artificial intelligence usage and approval procedure. Would you like to talk about any of those?
You want to talk about it?
Not really.
Okay. The first one was policies and procedures, just annual reviews or updating some policies that needed updated. The AI policy or procedure is just to cover us. Practitioners use a tool called Heidi in their clinics to, it's ambient listening, so that they can engage with the patients. They then are able to go back and do a much more in-depth note for the medical record. Is not saved, that information that it listens to during that conversation is then deleted after a short period of time. It allows the practitioner to, it imports it into the record, or you cut and paste it into the record, and it just helps them considerably. Would you agree?
And it's going to help even more
When it's interfaced?
when it's interfaced.
And it will be
I know.
in your lifetime.
I know. You don't know how old I am.
Who's?
Oh, maybe, but that's in your lifetime.
Any other questions? Okay, do I have a motion for items 7B and 7C?
People will sign their,
So in the patient agreement at the front,
every visit.
when patients sign in, they are agreeing to being able to,
Yes.
the practitioner to use the ambient listening.
Yes.
Okay.
Yeah.
That's good.
Yeah.
motion by Dr. Burke. Do I have a second?
Second.
Thank you. I have a motion by Dr. Burke, second by Dr. Brown, to approve items 7B through 7C. Roll call?
Burke,
Yes.
Simon,
Yes.
Mossberg,
Yes.
Brown,
Yes.
Hannaford,
Yes.
Bowman.
Yes. Okay, agenda item 8, homestead report.
Homestead had a positive month. In gross revenue, they had about $84,000. After expenses, they ended with a net revenue of $3,700 for the month. Finished with a cash balance of $165,000. And everything seems to be going really well over there. I don't hear any complaints. In fact, Emily seems to be doing a really good job.
Emily's doing a great job.
Okay, any questions for either Candace or Jane about the homestead? Okay, anything foundation-wise?
We'll get our arms wrapped around it one of these days,
Okay,
won't we?
We actually foundation-wise, we are getting ready to send Jamie, Ricky all of our reports. We got it caught up to the end of the year. I want to thank Ashlyn for helping me get that caught up, and I want to thank Kelly Parker for coming back in and showing me what all he was doing, taking some time out of his day to come in and assist us in getting that process moving again.
okay. St. Anthony's, nothing?
No, he will, I think he's only gonna be here once a quarter, I think is all.
Okay.
I haven't heard that.
Agenda item 11, city council report.
Okay, other than the routine business, two main things was Blake Treacle will be taking over as soon as Drew moves on to bigger and better things, and the city has decided to quit funding the flock system that was put here in town, so. The routine business, that's about it.
Okay. Any questions for Mr. Bowman? Chairman's report. Again, we talked about this last week, just real briefly, but although you get to June, but it's still a good year. I appreciate everybody's work. Appreciate everybody's work in the hospital. So we'll continue to do things better and wish you the best. We know we're going to keep you maybe for a little bit longer. Drew will be kind of month to month until we figure out when he starts. So it's good to see you though.
January at the latest.
January at the latest. Mr. Mayor, thank you for being here. Appreciate it. Any new business? Okay, hearing none, we are adjourned. Thank you.